Here's a perfect example of when a simple space maintainer such as a wire nance should have been placed to prevent the mesial migration of the upper left 6-year molar. You can see here tooth number J was lost prematurely. Tooth number 14 has erupted mesially into the space once occupied, also known as the E space. It's migrated 4 or 5 millimeters to the mesial. Patient here is going to undergo orthodontics, no doubt, or either have a premolar extracted, hopefully not, or that 6-year molar is going to have to be distalized back to its original location, 4, 5, 6, 7 millimeters to the distal. At the end of today's presentation, we're going to know exactly how to fabricate a nance, the steps involved. If you want to send it to a lab, great. If you want to avoid a lab bill and you have the time on your hands or want to train an assistant to do this in-house, you'll know how at the end of today's presentation. First, we're going to talk about when the primary first molar is missing. You're either going to have the 6-year molar in occlusion in the mouth, or you're going to have the 6-year molar not yet erupted. We're going to assume that the primary second molar, or the E, has not been lost prematurely and is able to band. So when the 6-year molar is not yet erupted, you have two choices. You can either place a lab fabricated band and loop or prefabricated band and loop. These prefabricated band and loops are made by De Novo, very simple to use, limited in their use in my opinion. Lab fabricated band and loop, far more superior appliance. Prefabricated band and loops are used exclusively in my practice in the OR setting or in a sedation setting where a patient cannot sit through band fitting, alginate impression, and band cementation.